health environment projects, Kenya, DRC, and Madagascar. And I think Janet's even going to tell us about a couple more. So you get a bonus 2 extra countries, 2 extra cases today. We aim to please. But really kind of reflecting what we're trying to do here at this program and at the Wilson Center in general, which is bring some of the lessons from the field and the practitioner world, the policy world, into a broader set of discussions that include and draw on the research, analytical, and academic world, and then really across some different portfolios, because as even the name suggests, pop, environment, and health, you're touching different communities that have different languages, expectations, ways of doing business, and so it's both a challenge, but as we will see, a real opportunity as we hear about some of the integrated programs trying to meet the needs of integrated lives on the ground and in the field. The Wilson Center itself, allow me just a moment to say, that is the formal memorial to Woodrow Wilson. Founded in '68 by Congress, we are set up to reflect Wilson's legacy as the only president who had a PhD. So they thought, instead of building an obelisk on the mall that we might all go take our picture in front of, that we'd have a living memorial where these worlds could come together and have proactive discussions to learn from one another. And so that's what we try to do on a range of topics. And with the Environmental Change and Security Program for the past 14 years, we've been doing that with issues of environment, population, health, development, livelihoods, and foreign and even security policy when the topics take us in that direction. So we're thrilled to have this series and this set of activities around pop, health, and environment, and some friends of the program coming here to tell us about what they're up to. We are webcasting the event live on the web, and really what that means for folks in the room here is when we come to Q&A, if you can wait till one of my colleagues brings you a microphone so that the folks online can hear your question. What it means for the folks online is that you will find the PowerPoints on the website that you can pull up so that you can actually see what our presenters are talking about when they say, as you can see on the screen. So go straight to it. Dario is going to kick us off. Dario Merlo is a project coordinator for Jane Goodall Institute's Community Center Conservation Program in DRC, and so we appreciate him coming. A number of us met Dario last year in Ethiopia, where he made some very compelling presentations of participation in a large East Africa PHE network program in Ethiopia, and so it's terrific to have him here at the center. For all of our speakers, we have the bios in front of you, so I'm not going to take precious time reading it, but it's terrific that Dario can come and share JGI's experience, JGI having taken on this integrated approach now for some years, and so it's terrific that they're doing it in DRC. Janet Edmond serves as Director of Conservation International's POP Environment Program, and is, as we describe in friendly terms, a recidivist by coming back to the center multiple times and sharing her insights and experience, and so it will be terrific to hear about CI's experience. Sam Weru is the World Wildlife Fund Eastern Africa Marine Ecoregion Program Coordinator for Kenya, which is a mouthful. As somebody who's the Director of the Environmental Change and Security Program at the Woodrow Wilson International Center for Scholars, I'm very sympathetic to people who have very long titles. What it means is Sam does very interesting things and will share the Kenyan experience and the WWF experience. And so we really have 3 very important conservation organizations really tackling these integrated programs on the ground. And so we look forward to hearing their lessons from the field as they take us all on field trips. And so I think, Dario, why don't we turn the floor over to you?
Okay, thank you. Good afternoon, everybody. Before starting with our community center conservation program, I want to tell you how the great pleasure it is for me to be here, come from so far, and be able to present you one of the country from which we generally listen some bad things. So what I'm going to do today is to present you these bad things, but also show you what kind of results we can have despite all the problem we face there. I will start first with...
Try point it at the computer and then hit the one on the right. So
okay.
I think it would try and point it there. So this one.
Okay. I will first start with a quick location of what we are doing and where we are doing our job. We work in the eastern DRC, which is located in Central Africa, as most of you must know. And our program is based in the landscape 10 that you can see in yellow on the principal screen, principal image. So our landscape is about twice bigger than Rwanda, so we are talking about big size landscape. And as you can see, the green in the landscape show the intact forests that are illustrated on the right corner. The red on the image shows the different places where deforestation is happening. So when we are talking about climate change, we are talking about this. This is the problem we address. This landscape have a really high potential in forest that I will present you later. You can see in the pictures below how bad can be things in reality if deforestation happen. And I will move now to a quick presentation of our landscape and what you find in it. The first thing is the rich high biodiversity that you can see here with lowland gorilla. About 90% of this species is contained in this landscape. You have also different species like okapi, which is only found in this landscape in the world and in this forest. We can also talk about the size of this landscape, which is about 50,000 kilometers square. So at least this is a really important landscape defined by Carpe. We can talk about something that people are really interested in when we talk about water. This is one of the landscapes which contain the biggest headwater of the Congo Basin. So the availability of fresh water there. Let's move now to something that you may know. Congo is well known for its insecurity. As you can show here in the picture, we have this problem with a lot of uncontrolled persons which have weapons. We have also, as a consequence of this insecurity, a lot of migration of people and poverty, an extreme poverty there. As you may know, the illegal mining is also a threat in this landscape, but you have also illegal hunting of endangered species like elephant, gorillas, or rhino. And then what we are talking about also is the deforestation. People there do this deforestation not because they want to destroy the forest, but because there is a lack of energy in this country, so at least they cut trees for making some charcoal. So charcoal extraction is one of the biggest threats also. Our program goal now is to attain a sustainable development in targeted zone for obtaining and contributing to conservation results where we are working. How do we do it now? That's what I'm going to present to you. The first part the first component of our program is to support environmentally sustainable economic growth activities. The other one is to give access to people of primary health care. And then the main focus of us that we are trying to have there is to involve the community in what we are doing. So we take communities as our partners. This is an example now on how we support the economic growth. This is the micro hydroelectric power in the village of Kasuo. This is a village which is well known in the area because it has the first and the only one university of conservation in Congo. So people who are there, and that's the reason why we emphasize on this place, is because the people who are there will be the leader of the conservation in the future in DRC. So as you can see here, on the first picture you have the way we built it. We created a lake and a dam. The two people who are there can show you how big is the lake. And the interesting story of this is that this dam was built by the community itself. Before Jane Goodall arrived there, the people already knew and decided that they need alternative source of energy if they want to protect the environment. So that's what they did. And JGI came for reinforcing their capacity to build it. So what we tried to do, because we didn't want that JGI is the manager of the will be the manager of the microhydro, we wanted to reinforce the local governance. So we created a management committee of this microhydro, and the management committee are people who come from the village and were elected by villagers. Let's talk about the sustainability, because this is one of the biggest problems we have in DRC. Most of the emergency NGO who are there arrive with some projects, implement them, and then just go. So at least you never know if the project will continue or not. And that's what we try to avoid. So what we did, we made sure that this electricity will generate some incomes. So how we did it now, everybody who consume electricity pay a monthly cotization. So the university who is consuming electricity pay cotization. Private people who have shops, like you can see on the right side, pay also some cotization. But also I want to emphasize on the fact that this electricity generated give access to the university, but also to the health centers who are in the area we are working in, and also to the radio station that you can see on the second picture on the inferior side. It gives access to electricity to the radio station. The radio station is something really important in the community we are living in, for one reason. Here everybody have books, computers, television, but you have to imagine that these people in remote places, they just listen to radio. When they are working, they listen to radio. Walking, everything they do, they listen to radio. So at least it helps us to spread the conservation messages, but also, as I will present you, the family planning and aspect, and every kind of local development and sustainable development we can have in the area. Let's move now to the other part of the support of the economic growth. We also provide in-kind to farmers, but also training, so they have a sustainable way of developing livestock. We also train them by showing how we do it by creating some demonstration units. So at least here you have some pictures which illustrate that. Our conservation efforts now, for helping these people to protect their forest and the environment, we are trying to give some equipment to the park rangers and the eco guards. The eco guards are the people who are working in the community reserves that I'm going to talk about. The park rangers are the people who work in the national park, which are included in the landscape. So the result of this is the creation of more than 2 million hectares of community reserves, which is a lot considering the size of the landscape. But also these people were able to realize more than 229 patrols during this year. And during these patrols, they have a lot of things that they find, like ivory from elephant or snares. Here I just took this number because it's quite important, about 2,000 snares that they found there. And they also find people with gun who are just hunting, so these people are able to bring out these people and arrest them. They were also able to realize a coverage of 40% of this forest. So it's maybe hard to imagine how they can do it, because they are doing that in the forest where there is no road, so they have difficult access, but at least they are able to realize it. I was talking about the community reserves, and that's exactly what is illustrated here. This map shows the limit of the landscape, and in light green you have the 2 national parks that gave the name of the landscape. The landscape name is Maiko Kauzibiega. These 2 parks are well known for the gorillas which are there, and a lot of bad news are happening, and this concerns exactly these places. So in dark green now you have the community reserves that I was talking about. So the question is to know how does these people create these reserves? Before JGI arrived in DRC, some local leader that we call the Mwami means kings, some local leaders decided to protect the environment. So what they did, they created some reserves, because these people are the owner of some big land in the landscape, so they decided, okay, we have to protect it. Now, what they are waiting from us is to give them some support, because at least if they protect the environment, if they don't want to cut trees, or if they want to have clean water instead of polluting, you have to give them the possibility to do it. Alternative source of energy is one of the key to do it, but I will show you. I will show you later how we implement that. But it's really important to understand this concept of community leaders, because these people also give us access to the community. So at least it's really important to have them on board when we try to create any kind of activities. Let's talk now about how we implement the health program. The first component of this health program is malaria prevention. We distribute mosquito nets and also anti-malaria doses in the health zone we are working in. And the other part of our health program is the family planning activities. And this is the biggest activity we have in the country, as it was judged by the people there that it's a real need to give them access to different things. And that's exactly what we are trying to do. The first thing is that we try to train the healthcare providers, because at least they need to have this knowledge, and so we can improve the way they are giving access to the people of primary healthcare. We also provide different methods, such as IUD, female and male condoms, pills, and some natural methods like cycle beds. What we do also, because it was a lack of the government, we try to rehabilitate some clinics and health facilities. So actually, we have already rehabilitated 6 health facilities on 71 we are working in. The other big part of our work is the sensitization. And how we do it, we have 3 components on this aspect. The first one is by radio emission. So the radio, who has access to electricity, are really important for us, because it's the only place where we can spread the different messages concerning family planning, but also environment. But also we have a really interesting theater group who are going from one village to another, from one area to another, and these people are able to sensitize and educate people on family planning, but also on environment. And also we have, as I talked to you about the importance of sensitization of the communities, we have some volunteers in the communities that are called the CBDAs, the Community-Based Distribution Agent, who are working in different villages and educate people on family planning. So what we do also, because it's something about, from here it's difficult to imagine that some health facilities don't have gloves or different disinfectants. So what we try to do also is provide this kind of product. And for the following and the monitoring of the project, we do a monthly monitoring and quarterly supervisory visit. Let's talk about the numbers now. We work in 3 health zones in 71 facilities. So we are talking about a lot of people, about 500,000 people that we are trying to help in this area. And I will talk also about the target people, target women, which are the women who are at the reproduction age. There are about 123,000. Briefly, I will give you this number that we did during the last 4 years. We conducted 41 training sessions, during which 894 providers, healthcare providers, were trained. So this represents a lot because at least in all the area you have 1,400 people working in the health facilities. So most of them have been already trained. We renovated, as I told you, 6 health facilities. We provided more than 236,000 doses of family planning methods. Actually, 489 CBDAs are working in the different communities. And we have a number of more than 15,000 people using the methods. So at the scale of the landscape is a few, but when you come from nothing, this is a lot already. Let's talk about what we learned from our 4 years in DRC. The first one is that it's possible to obtain some results despite the insecurity. At least you have to work carefully, but your result can be effective. But I will say for having that, the local community governance is a key in the process. We will say that as a part of it, the community leaders are the people who can help us to involve their communities and the people who are living there in what we want to do. I will say, as I told you, that the volunteers are key in we have to educate and mobilize people on different aspects. And the use of the media, this is something that we don't think about, but the access of knowledge in DRC is one of the biggest problems we had there. But we saw that when people can have access to it, this changed the behaviors. And I will say that the most important is to have the communities as partners. Last time when our president were in DRC, he came in the village, and the first thing he did was to meet, as you can see here, with the local village chief. So this means a lot, because when people from there see some American NGOs or European foreigners NGOs coming, generally these people don't work with the community, so at least you never know what can be the result of your work. But if you involve them and if you show them the importance to have them with you in what you are doing, at least it reinforces your capacity to implement your project. Now, the program challenges. As you can see, we have big infrastructure problems. This is our car when we were going into the field. At least instability and insecurity in DRC is something everybody knows, and in fact it's a problem. But we deal with it, and we obtain results despite the fact that there are instability and insecurity. The health facilities, as the roads are in really bad condition, so that's the reason why we are trying to renovate them. The lack of the government support, and this is also a reason why we try to involve these leaders, the Mwamis, which are considered like kings in the area, because sometimes they are the only representative of the government in these places. And I will finish by saying the religious and cultural barriers are sometimes a problem, but we also try to involve the different religious leaders in what we are doing. Thank you.
Perfect, Dario. Why don't we, Janet, I'll switch, but why don't you go ahead and get started?
Okay. I want to thank the Wilson Center Environmental Change and Security Project for having me back. I am here a lot. I feel like this is it's kind of the PHE living room in a way. It's a place to come and see old friends and meet new friends, and it's definitely an opportunity to get away from the daily, details and sit back and reflect on what we've done and where we're going, and it's always a good opportunity. I always find myself in the days after a session remembering something, thinking about it, and I think it's really very, very helpful to have these opportunities. So I'm glad you were all able to come. And I want to also thank my co-presenters. I'm very excited, and I feel like our presentations are going to have a lot of synergies, and I hope we'll have a good discussion afterwards. I've been the CI Population Environment Director since January 2004, and I'm here presenting, as Jeff said, the work of our Cambodia program, Philippines, and Madagascar. And the results you're going to see are really the results of the work of a lot of people on the ground, and I really give all the credit to the people, our partners, our CI field staff, all of our collaborating organizations, governments, and so I'm just merely the conduit for that information. So going forward, I think actually, what's it?
Maybe hit it back if that's
Back,
into your
please.
slide, just to back a couple times.
Yeah, let me just go back. So as many of you know, CI has had a population environment program going back to 2002. We have been very happy to receive support from the Office of Population and Reproductive Health. We have called our program Healthy Families, Healthy Forests, and this is the cover of a publication which is coming out very soon, be in your mailbox soon, which demonstrates our results. And right now, most of the results I'm going to talk about are 2005 to 2008 because that's the agreement that we're talking about right now. So, and as you can see, like I said, Cambodia, Madagascar, and the Philippines. So, as many of you also already know, CI's mission is to conserve global biodiversity, and we try to demonstrate that we can do this in harmony with human societies. So, and this is a challenge, as many of us already know, and we're constantly trying to push the envelope on this and make sure that we are doing what we say we want to do. So, any CI presentation has to have the hotspots framework in it. These are areas of high endemism, so there are species, flora, fauna found in those hotspots, which are found in nowhere else, and there are 34 of them around the world, and they're under immense threat. There's already 70% of plants lost in those areas, so the need to conserve is critical. So I won't spend a lot of time talking about kind of the PHE approach. I think Dario's already done a great job of doing that. I'll just summarize and say that our main objectives are to reduce population pressure on natural resources and the environment. And we do that by increasing access to family planning, reproductive health services. We also expand that a bit to include maternal child health services and some of the other things that people need in communities in rural areas. And at the same time, we work with communities to improve their ability to conserve and to improve their natural resource management use. So, and obviously, the first thing that we recognize is that the people on the forefront need to be healthy in order to be able to do that. So we have put investments in making sure they have access to services, they are healthy, they have the tools to be able to accomplish conservation. So, and I won't spend a lot of time talking about threats to biodiversity. I think Dario's already mentioned quite a few of those. And also just say that we're always trying to improve and be able to prove that the links between health and conservation are there. So, okay. Let me move into the areas where we're working. This is Madagascar. So we're in the eastern corridor of Madagascar. This is Cambodia, and many of you may have already seen some of my colleagues present on this at previous Wilson Center events. We're in the southwestern part of Cambodia, in the Cardamom Mountains. And then this is a map of the Philippines in the north, on the island of Luzon, and the Sierra Madre Biodiversity Corridor, which is in the green areas there. So, overall, all three areas we're targeting about 45,000 people. So significantly less than what Dario just presented on. So the scale is very interesting. So, and I have to say, one of the lessons learned that I have is I was a Peace Corps volunteer in Morocco, in the mountains and the desert down the south, and I thought that was remote. But then I went to Cambodia, and that is really remote. And I also fell in with the leeches there, but that's a whole other story. But so this project has really shown me that it really is very difficult and very expensive to get out to those rural areas and to reach those people who need the services. I mean, I thought I knew what that was like, but then, you know, my mind was opened. So anyway, so let me just jump in and talk about our accomplishments. So we partnered with a variety of health development NGOs. We have different models for doing this. We've learned a lot in terms of developing partnerships and operating partnerships, obviously. And in the Philippines, we've worked with NGO, but we've also worked with local barangay health workers, which are kind of the lower level district people on the front lines. And the LGU is the local government unit in the Philippines, which has a very decentralized system of getting, you know, power, basically decision-making authority down to the local level. In Madagascar, we have two NGOs. One is ASOS, which is a national NGO, delivers health services across Madagascar. And then Mateza, which I won't even try to pronounce the Malagasy name for that, which is a very small NGO which is working in the very, very northeastern part around the Zemena protected area. So, and they have a real challenge because to get out to some of their sites, it's a 2-day walk through rivers and stuff like that. So they get definitely a lot of credit. And then in Cambodia, we've worked with CARE, which has an office in Cambodia and which is, you know, got a little bit more capacity, a little more resources behind it, a lot more experience. So we have some lessons learned across those experiences. So, and this is a horrible picture that I put together, which you can't really see, but the Cambodia Health Center is something we did with CARE. It was the first time health services were delivered to that area. So 3,000 people who basically would have had to go 8 hours to get to any kind of health service now can just go an hour walk, 2-hour walk next door to get services. The picture on the bottom with the women with their certificates are in Madagascar. They're our community agents. And then the other picture is the Philippines, and Miriam, who is a midwife there, who really has run our program for a long time. She is a dynamic educator and really a PhD success story, definitely. So this just shows you some of the accomplishments we've had in family planning, reproductive health users. We've increased our number of users significantly over the last couple of years in all countries. This is contraceptive prevalence rate, which has gone up in Madagascar and the Philippines. We measure it differently in Cambodia, which is why it's not up there. But we also have seen significant successes there. We measure it as couple-year protection, and it's gone from 34 in 2005 to 134 in 2008. So that's pretty significant. And this is just an example I'll put up there of diseases that are definitely related, health and environment. Diarrhea, as we all know, is caused a lot of times by poor water, lack of quality of water, and the acute respiratory infection, which is also caused sometimes by the burning of the wood, the charcoal, like Dario talked about. And so this is visits for children at the health center in Cambodia. And we saw a spike 2006, and now we've seen a decrease. We can't attribute it directly to anything that we're doing, but it is interesting to note. And then we want to say that we can't underestimate the ability of people to be able to plan and manage their own resources. So we built a lot of capacity of local groups, people, community, natural resource management committees, that kind of thing. This is a picture of a process in Cambodia which is called PLUP, which some of you may have heard of, Participatory Land Use Planning. And it's a national initiative in Cambodia. And our team in Cambodia has worked a lot with locals to be able to develop maps for areas that should be conserved, should be developed, rice fields, and it's been a long process, but it's definitely getting us to the point where we can implement initiatives that help us achieve conservation outcomes, but also help the community meet their needs. So planning always sounds kind of boring, but this is just a slide I stole from one of the Madagascar presentations, which gives you an idea of how much they love to organize. They love to have groups. They've got a women's group that's focused around nutrition. So they're looking at basically getting their kids more fruits, more vegetables, and by doing that, they're doing projects which help conservation. They're doing vegetable gardens, replanting trees, etc. And they have a ton of village volunteers, and they all have different names, and so just want to throw that. And then finally, we've hit conservation targets that we wanted to hit, and we've done this by helping people do environmentally friendly livelihoods like agroforestry, improved rice production, and those are just two that I'll mention, but there are a lot of others. We've increased significantly the number of trees we replanted, which is helping to restore habitat, and then this one is hectares preserved of improved rice production. So all our indicators are going in the right way. So, and then the last thing I just want to mirror something that Dario had said is that we really think that our legacy is that we've really built the capacity in the communities, in the people, to be basically our agents of change. They're the ones who are integrated. Now they know how to do the family planning, the health, the conservation. It's all rolled into one, and that's really our legacy. So going forward, we do have some challenges in terms of funding and how we measure effectiveness and that kind of thing, but we're really, really excited that these guys are there, they're ready, and really it's just a question of moving forward. So this is from Madagascar, one of the village theater. They love the village theater. We've also reached out to students. We've got the young, we've got the old. This is Mar, our coordinator in Philippines out there. You'll notice that there are men and women involved in the health activity, so we've tried to be very gender focused. And then just thank you. This is my one more lesson learned. It's about always being very diplomatic and never burning any bridges, because you never know when a graduate student you invite to come to a workshop years later is going to turn out to be your main point of contact at USAID. So that's Heather in the Philippines back in 2004. So,
Terrific.
Thank
you very much, Janet. Tim, I'll switch for you too, but go right ahead.
Okay, thank you and good afternoon, everyone. I'm happy and privileged to be here in such a diverse gathering to share examples of our PhD work from one little village in Kenya known as Kiunga within Lamu district. And Kiunga is located to the north coast of Kenya, next to the Somali border. And although I'll be talking about issues of insecurity, don't worry about the piracy. Kiunga Marine National Reserve is one of the most biologically diverse areas of Kenya. Perhaps it's the only remaining pristine marine area with pristine coral reefs. Harbors about 2/3 of the standing biomass of mangroves in Kenya, and the most important marine turtle breeding site within Kenya. And for those of you who like big game fishing, it's one of the most important billfish breeding site, I think, in the world. I talked about insecurity. Being close to the Somali border, we've suffered a bit from the infighting within Somalia. A number of biodiversity challenges with regard to marine turtle poaching, because marine animals don't know any boundaries. And although we protect marine turtles on our side of the border, they are butchered across the border. However, within the area we have Lamu Village or Lamu Island, which has been declared a World Heritage Site a few years ago. It's one of those old coastal villages representing the Swahili culture. There's only one vehicle belonging to, I think, what you would call here the governor, and a lot of transportation there is done by old traditional boats known as dhows or a donkey. So there's a donkey clinic actually, to treat donkeys, just like you'd have your car garage. But like my colleague Dario mentioned, Logistical difficulties. There are no roads, very close to what you saw in DRC, perhaps worse. Lack of basic amenities like hospitals and schools, and therefore it makes it very difficult and expensive to work in. WWF is the only NGO working in this area currently. Challenges in access to healthcare, like I mentioned, education, high level of illiteracy, and a very high level of dependence on natural resources. And therefore you can imagine the threats to biodiversity with the ever-increasing demand for food globally. And Kiunga being one of the, I think, the most productive area in terms of marine fisheries in Kenya. Most likely, if you ever had lobster somewhere in a restaurant, I would bet you 1 out of 10 you've had one from Kiunga. A lot of harvesting of mangroves is not sustainable, although this has been addressed by the government by banning the export of mangroves especially to the Middle East, which was the biggest market. But the good thing is they still allow for domestic use of mangrove posts. Bycatch and illegal use of illegal fishing methods is a big thing. Net sizes that are below the threshold in terms of mesh size. The legal one in Kenya is 2.5-inch mesh. A lot of people use 1 inch and less, up to the level of a mosquito net. I did mention earlier there's a high dependence on natural resources, both fish and mangroves, because of lack of alternatives. And therefore, it made it very difficult for us as WWF to spread our message of conservation. It's one thing to tell people not to eat a marine turtle, or not to cut mangroves, or not to fish a certain species of fish or in a certain area, but they have no alternative. Their immediate needs are health, water, education, and therefore we looked at how we could spread out our message of conservation by integrating our work with social needs. They need health. So we went in and, in collaboration with our health partners and the government, we started mobile clinics where we'd go to other villages and immunize children and expectant mothers. Basically, because we'd have also a doctor on board, we would treat any kind of ailment that we encounter. And while doing this, we would also spread the conservation gospel. You'd get a dose of your vaccine, then you also get a dose of science of conservation. In some places, we would develop infrastructure. The picture on the left depicts one of a dispensary in one of the villages, built by collaborative efforts of the village folk there, but it never operated because the government did not classify it as a suitable health facility. Therefore, they could not supply medicine or qualified personnel because it was substandard. So we went in, and with the help of partners, Johnson & Johnson and USAID, we built the structure you see on the right, which has a pharmacy, a store for drugs, a consultation room. It has a small room for expectant mothers. There's a big waiting area which can also work as a training center. And this is recognized by the government, and therefore this village were able to get medicine, although we still have challenges in terms of maintaining personnel there, because the government would send a personnel to run the dispensary, but because of the challenges of living and surviving in this area, the person sent there would not last for long. They would, after 3 months, would look for a transfer to go and work elsewhere. So we're still working on that, but at least that alleviates a lot of the health issues. Water supply is a main challenge in this area. A lot of dependence on boreholes and wells. The one on the left is before our intervention. This was an open borehole, lots of dirt going in, and therefore water contributes to a lot of diseases in the village. But we worked with partners to to cover the well and install a hand pump, treat the water, and this eradicated the incidence of waterborne disease in this one village. Just that simple action. So it's a very essential tool. Because of all these logistics, the difficulties in logistics, any expectant woman depends on a traditional midwife for the delivery as the first line of defense. And therefore, unless there are complications, rarely do they go to what you would call a hospital. Therefore, what we do is to train the midwives on better methods of delivery, on how to train the mothers on safer, on how to provide nutrition for their newborn, how to take care of their children, of their babies, and the benefits of family planning and smaller families. And this has worked very well. Although currently it is in conflict with the government policy, because the government policy is to do away with the midwives and replace them with qualified personnel. But in these kind of villages, it will take a while before this policy takes effect. So the midwives continue to play an important role in Kiunga, in this particular village. I did mention the high dependence on natural resources and over-harvesting of resources like fish. It is illegal in Kenya to use fishing gear that is below 2.5-inch mesh, but 90% of the fishermen in this particular area use illegal fishing gear. So it's one thing to enforce the government law, but that would, in essence, put 90% of the population out of a livelihood. So we've worked a program whereby we replace the illegal fishing gear with the legal one, would provide the fishing nets to the fishermen, and they would pay a certain percentage of the cost of that gear given a time period. And by doing so, we reduce the conflict with the government. The fishermen would infringe less on the law. It would also increase the quality of their catch. The fish would be bigger and bigger, that is, the fish which is landed, and contribute to ecological health of the environment. The Kiunga area is at the meeting point of two ocean currents, one flowing from the north, the Somalia current, and one from the East African region. They confluence in this area, and by so doing, there's a lot of debris that comes from all over the world. Flip-flops is one big challenge. We organize the community groups, youth and women groups, to collect this debris, especially the flip-flop, and work them into handicrafts. Beautiful little things, wall hangings, bracelets, baskets, some just beautiful stuff that you can buy and make money out of it. The money goes to provide for the needed domestic requirements, lighting for the house, maybe some improved food. You pay school fees for your children, pay more for health care. So it's very well needed cash in this region. Another of our health interventions is malaria control. As you know, children below 5 are affected more and more, and we provide bed nets to families with children below 5 years or expectant mothers, and this helps to control the incidence of malaria in the region. The youth are engaged in conservation activities that are fun to practice in. One of them is the marine turtle conservation, and by doing this, working together with our partners, we'll spread a word or two on HIV/AIDS and how to practice safer sex. At the same time, we would increase our conservation ideals. Recently, we did launch a satellite tracking program where we track marine turtles by satellite as they move all over the world. This began last July, so we are yet to know all the individuals who are tracked by now are still within the East African waters, so we yet to know where they go beyond East Africa. But because of the involvement of the community, out of all the nests that are reported, 67% are reported by the members of the community. And as a result of this collaboration, every year we are able to ensure that over 10,000 marine turtle hatchlings emerge and enter the sea successfully. This is our benchmark. Sometimes we get more than that. In terms of family planning and immunization, we've seen the uptick of family planning increase rapidly, and as well as coverage of immunization of children below 5 years has increased over time. We hope to reach the 100% coverage perhaps by this year or next year. And to summarize our achievements and in terms of livelihoods, I did mention of the flip-flop art. All the participating households are able to increase their monthly income by $130. This may be nothing in terms of what you spend here in the U.S. Maybe it's one day's expenditure while in town, maybe traveling, paying your taxi or your metro. But for a village in Kiunga which has no other household income, this is a lot of money, and does it goes a long way in providing clothing and improving the domestic lifestyle. I've talked about how the community participates in our conservation work. There's an increased buy-in into our conservation work, local support from the politicians and the elders in the area. We've increased our partners. As a conservation organization, perhaps your donor base is limited to people who can only support conservation. But by bringing in the PHE work, we bring in partners who would otherwise only support humanitarian aid. So now, by integrating conservation and environment work, we're able to increase our donor base and therefore our funding base. The main message that we like to give the local population, the local politicians, the leaders in the area, is that conservation is for you, the people, and it is supposed to be done by you, the people. In other words, we are conserving the environment for the people, and therefore a healthy people and a healthy environment. The lessons that we've learned over time is that it is important to integrate PHE work right from the beginning of the project. When you're planning, PHE may have been in practice for the last, I think, 4 to 5 years, but would have been worthwhile to start planning your project with PHE in mind right from the very beginning, and that you ensure that all your partners, after selecting your partners, you ensure that they understand what their role is going to be and what they are going to be responsible for, and how they are going to join you in carrying out the activities and sharing the resources. By and large, the conservation world is practiced by biologists, and therefore we may not know how to deal with changing people's behaviors and attitudes. If you're talking about family planning or talking about conservation, it's all about changing attitudes, and therefore you need skills beyond the biological, the ecological skills. You need social skills, and we've learned the lesson that we need to bring in both biological skills and social skills in doing PHE work, because you're basically dealing with changing people's behavior. Sometimes, as conservationists, we are very comfortable doing what we do best. We are poor at communicating what we do. And I think PHE work needs to be effectively communicated to all levels, the policymakers, potential donors, and other scientists and practitioners in the field. And I'd like to end my presentation there. I thank you very much and wish that one day you'll be able to visit our beautiful seascape.
Terrific. Well, thank you, all three of you. You've given us an awful lot to think about and talk about. Why don't we open it up to the discussion? And then I should also say, for those viewing online, if you'd like to send in an email question, as one already has, you can do that at ecsp@wilsoncenter.org. So who would like to kick us off with a first question or comment? And as I mentioned, one of my colleagues will bring a microphone to you. I'd like to jump in first. Yes, down at the end of the table. Karen will bring you a mic.
Actually, I have a kind of a random question, actually. Why are the mangroves exported to the Middle East? What are they used for?
And if you could tell us who you are.
Oh,
sorry.
my name's Sharon Rocco. I'm with JSI.
Thanks, Sharon. Sam, go ahead.
Okay. Mangroves are very hard. It's a very hard wood, very tough. It's termite resistant. It needs no treatment to survive a termite attack or the elements of nature. They are used in construction, basically, and where you'd perhaps use concrete to make pillars and columns in a building, the mangroves replace that, especially in marine areas where corrosion of steel is very high. So mangroves can last up to about between 30 and 50 years as pillars and beams in a building. So they're very good tough wood for construction industry. They also used to make boats and dhows. Dhows are traditional, like the one you see at the bottom right. This is not very clear on the slide, but these are traditional vessels that sail the coastal waters of East Africa, and have known to sail between the Middle East and East Africa for centuries, transporting goods between the two regions.
Terrific. I have a couple I'm going to jump in with. Sam, you mentioned the Johnson & Johnson support as something that was part of the package. And so in some ways a question for all of you, but this the notion of the advantages and disadvantages of multiple funders, potentially for different parts of the projects, and how has that either made it easier or made it harder, or kind of what's the balance of your various experiences in having multiple funders for a single package, so to speak. Janet, could you say a word about, I was interested to hear about the improved rice production in terms from a food security perspective and the conservation perspective. What are you achieving with that particular program? And then I'll stop because I do see some other hands. I can keep going, but why don't we'll start with that.
Okay, if I could answer the question of multiple funding or multiple donors. It can be a challenge sometimes because some donors come with vested interest. If you're not careful, a particular donor may change your focus. For example, we are basically an environmental project, Kiunga, but some donor may want you to change that into a health project. And therefore, you've got to be very careful in ensuring that the donor understands the principal focus of your project and comes in to complement that rather than complicate it. Sometimes, if you have multiple donors or multiple funders, and reporting can become an issue. Everybody wants a technical report in their own format, or a financial report in their own format. And you can imagine if you have like 10 different donors, and each wants a report in their own format. And yet, for example, like WWF, we have our own format. So that can be a challenge. Mm-hmm. But in an area that is so remote, with not, less interest from so many from donors. Some donors look at the bigger picture. Sometimes they like to fund global warming, for example. They would like to fund perhaps a rally, a public rally or a demonstration. But yet you want to do something, something real. You want to save a turtle. You want to put a tag. Sometimes when you have such challenges of adequate funding, you may as well have, you take the chance, but then you have to stand your ground that the donor does not change your focus.
Thank you. That's all. Janet or Dario, do you have any?
No, go ahead.
Just from CI's perspective, we do have a lot of projects. Just Cambodia, for example, we have the French Development Agency is putting a lot of money into the cardamoms protected area to delineate the protected area, work with communities to work on that. So, and that's a big grant. That's a very big grant. So we've actually seen that as an opportunity to leverage those activities and those resources and a lot of the consultations that have come in. I know that there is one program we have at CI that has leveraged our program, and they've done a very good job. It's called Conservation Stewards Program, and basically they make agreements with communities, and they're given some sort of benefits package, and then they do certain conservation activities. For example, the pangolin is a species in that area that's very endangered, and it's often the Chinese there's a market in China, and so the people in Cambodia are exporting that. So what they've done is say to the communities, okay, we'll give you teachers in the schools who will stay there, and in exchange, you can make sure that nobody takes the pangolins, and there's forestry guards and that kind of thing. So, and that program really built on a lot of what we had done with the land use planning and that kind of thing. So there are disadvantages to having lots of donors, but there's lots of opportunities too, I think, that we see there. So
On rice, do you want to mention?
on rice, I'm not a rice person. I don't know all the details.
Neither am I. That's why I asked you.
There's actually two things. We're not doing rice production in the Philippines, but in Cambodia, where I believe Sarah Milne, who was here a couple of years ago, did a presentation where she had indicated that they had done some research in the cardamoms, and communities there, families there, only had enough food for like 8 out of 12 months. So they didn't have sustainable, sources of food. So what we did there was to look at a lot of the areas that had laid fallow, and mostly that was because of the civil conflict. And again, with this stewards program, we looked at areas that were being used, weren't being used, and we did partner with a group called SADAC, which is Cambodian Center for Education and something else. I'm sorry, I can't remember exactly. But they have done a lot on improved rice production. And so we worked with them to be able to get a tractor in there. I think at one point we actually used buffalo to go in there and try to still the, whatever that word is, to try to get the land back in use. And there were plots that were put back, right, exactly. So there were plots put back into production. And then the idea is to make it sustainable, so it's not using a lot of pesticides and fertilizers, but to do it in a way that's environmentally sustainable and conservation. So we also were doing the same thing in Madagascar, but without the kind of partner, the high-level partner. We were kind of doing it more on the ground. So, yeah. And both of those, they've seen increases in the amount of rice production and hectares. I think we've had like 500 and something hectares under improved rice production. So, and it helps with habitat too, so it's not so destructive.
John?
Hi, I'm John Pielemeyer. I'm an independent consultant, and I have been involved in evaluating these PhD programs. And I'm going to ask you a question I probably asked you before, but I might get an update. These are excellent pilots from the results, and the question always is, what do you do with an excellent pilot? First, can you sustain it when the donor goes away, or can you find somebody to help you scale it up? And how have you done in your programs? Have you found either a way to sustain the program when the donor departs, or a way to scale them up?
Okay. From my experience in Lamu is that we've been so successful in what we are doing in a smaller area in Kiunga, and we are now scaling up, and we have found 2 donors to help us scale up, and I'm happy about that. The only way to ensure that you sustain your efforts when you don't have funding anymore is to work with local partners, both government and community, so that the momentum is built even after within the time frame when you have funding, and therefore they will be able to continue thereafter. In Kenya, we're working with the Ministry of Health, one organization known as Family Health International. I believe they have an office in the U.S. And also lots of community groups. Each village has a community group that deals with health issues.
Well, I don't really have a great answer to that question. We do have a lot of work to do on scaling up. It's one of our main challenges. I think a great opportunity that has recently come about is the new PHE Technical Leadership Project, which has come out of the Office of Population and Reproductive Health. It's called the Balanced Project. We have a fact sheet, actually, that we can circulate, and CI is a partner. We're a sub to the University of Rhode Island Coastal Resource Center, and we can hear from Linda, who's the project director, maybe in a minute. Let me just go back to the scale up for a minute. CI itself is still working very much in the Philippines and Madagascar and hoping to continue in Cambodia. We do have some fundraising to do, to be honest. We do need to look for some alternative sources of funding. We have a lot of ideas. We're working on it. We are also working through a lot of the existing networks that have set up. We have some great networks in the Philippines, which is working at a national level with all the NGOs who have made a lot of accomplishments there. Madagascar, the same thing. We're hoping to work through that network. And so we have a lot of momentum, and we do have a challenge of getting money in hand, definitely. But maybe Linda can talk for a minute about the new project. Would that be okay? Or?
Can we give Dario a chance first to talk about his experience, and then absolutely.
Yeah, I would say that, as Sam said, the first important thing is to, when you start a project, you have to think about the sustainability of this project. So what we do in our case in DRC, we try to involve the community governance. So at least we always keep in perspective that there are possibilities. In the best case scenario, we will stay there, but there are possibilities that someday we leave. So we try to help the communities to manage by themselves. Also, what we have tried to do during these last 3 years is to involve the government, the national government, in what we are doing, because we have to keep in mind that what we are doing is because there is a lack of government support, at least. So we have to involve them more, and it becomes a real challenge during the elections, because it's the time where everybody wants to show what he is able to do. And these people from the government, that's exactly when we are trying to involve them in our activities, because they want to show also to the people that they are doing something. So at least we are trying to figure out this by responding with local governance and involving the communities. But I will briefly say something about the different sources of donors. I think the best part of our program is that it's an integrated approach. So each donor can find a way to find what is interesting in our program by taking into consideration what is their focus. So some of them are more focused on health activities, family planning, or malaria. Different ones are more focused on livelihood and different alternative source of energy. So at least we try to take advantage of this and take that as an opportunity.
And Sam, can I just for a moment follow up on your point, saying that the Ministry of Health is involved? Was there some lesson there in how you brought the government, the national government, in to and provide some of their resources rather than the external donor-driven? Was it data and results? Was it filling a need that's less expensive for them to do a need and provide services that they otherwise would have to do? Was there a key deliverable that your project had that meant that the ministry paid more attention and wanted to put money into it?
Well, I think one way that the government found it easy to get involved is that we worked through the local representation of the government, that is the local district hospital. And one thing that you have to do is to get the medical officer of health in that district to work with you, to support what you're doing, to involve him in the planning, and kind of try to iron out what are his challenges. The government may have personnel, but may lack perhaps a vehicle to move out into the field. They may even have the drugs in the district hospital, but lack a mechanism to distribute those drugs. And that's the kind of need we filled within these remote areas. That is, provide a mechanism, a logistical system to the government to provide the service that they should otherwise be providing. And working with them, we were able to find out that the dispensary that was in his one village could not get services because the government does not recognize it. Therefore, those discussions, we came up with, what if we build the dispensary? Would you be able to support it? And therefore, they said, okay, fine. Here we have 3 or 4 plans. Choose the one that you can afford to build. And they can't go back on that. They know they promised to get involved because you provided a need which they were lacking or they were unable to provide, and they end up feeling compelled to take action and to get involved.
That's great.
And to build their own capacity, because they do realize that as an NGO you may pull out at any one time. Mm-hmm. So and since they are involved with what we are doing, they have a target also to achieve. If we withdraw.
Yeah, I think it's a very valuable lesson. Linda, could you tell us about the Balanced program?
Yes, thank you very much. And I'm not going to take very much time because this is really their stage. But since it was brought up, Janet, I'm Linda Bruce, the project director for the Balanced project. We were just awarded the University of Rhode Island's Coastal Resource Center, which is awarded the 5-year cooperative agreement. Our partners are PFPI, Path Foundation Philippines, in the Philippines, obviously, and Conservation International. And I've passed around a little flyer. I would like to address my comment to address yours, John. And it's nice to meet you. I've read so many of your documents because I've worked on the iPopcorn project in the Philippines. First of all, we have 3 areas of focus in the Balance project. One would be increasing PHE knowledge among donors, the field, to get more advocacy around the area and spreading the information and knowledge for everybody to use and tap into. The second would be building the capacity of people in the field, of the practitioners and policymakers in the field to actually be able to pull together and develop their own projects. The third area of focus is the most weakly funded, as most of you guys know who work in development. It's going to be, we will need to seek funding from outside sources, missions, etc., to foster the implementation of field-based PHE projects. And of course, we really would like to build on what's already out there. So our job is to do a major advocacy work to support and garner funding to continue very successful projects that have been put in. But that's where we don't have guaranteed money. So like all international development projects that I've worked on, and most of you have worked on, continuing sustainability is always the biggest challenge. And we've got 5 years to try to work on that, and then you can ask me in 5 years if I've addressed your question. Thank you.
Terrific. Thanks. Kristen?
Kristen Patterson with the Nature Conservancy. I know in the case of JGI with Dario, they've already sort of the project in the DRC is a replication of work that they've already done, started in Kagoma. So that's an example of JGI sort of taking the PHE approach to scale in other landscapes. But as we all know, WWF and CI are much larger organizations than JGI is, and they work in many countries all over the world. And I'm curious to know, from your perspective, how much success you've had in sort of selling this approach to senior managers within your organizations, and why or why not you think that doing integrated population health and environment work has been accepted or not accepted within your organizations.
And after they answer, I'll ask you to answer that for TNC as well.
I've only been at TNC for 1 year, so I take no responsibility for it. I'm working on it.
Actually, the work we are doing in Kenya is part of a wider PHE work in Philippines and Madagascar and Congo. That's that's one big plus. But within WWF, we are trying to market, so to speak, the PHE work within other programs. And currently we are planning to introduce all the program managers for other programs within, at least within the East African region, to the work that you're doing, what I've just shown you here, to kind of create a curiosity, if not a need, for them to integrate the PhD work in their programs. So we are working on it.
I think for CI, as Sam had already mentioned, conservation groups have been mostly run by biologists. So it's been a tough sell. There's no way to whitewash that. And you know, our outcomes are species protected, hectares protected, that kind of thing. So our outcomes are at a very, very high level, and the activities that we're doing and the accomplishments we have are kind of supporting those outcomes, but they're not very close to it. It's a long progression. It takes a long time to be able to convince people that we have reduced population pressure, that kind of thing. But I have to say, I do feel that there's a tide turning within a lot of organizations. In fact, I read something that TNC had up. It was an issue of their magazine, which was about people and their role in conservation. It was a couple months ago. And so I feel like, I know at CI we're having lots of discussions about this, you know, that live harmoniously with nature, human societies. We're really trying to unpack that and figure out how we can really tackle that. So there's a lot of discussion going on, and I think a lot of things are changing. I think a lot of kind of the funding is driving this. I've been to several meetings of groups of population organizations that are saying, oh, we should really get with the environmental community, and then the environmental community is saying, oh, we should really do more development in health. And so I think there's a lot changing. But I do think it's hard, because I do think, as we had talked about earlier before this meeting, conservation groups don't want to touch population. They just want to leave it, I think. But I think the more that they can see that the goodwill that's built by these projects at the community level, there's a lot there we can tap into. So.
Let me, maybe I should add to that and say that, it can open up a whole big argument. Especially from the classical conservationists, the more you're educated, the more your footprint, the bigger your footprint. The more you improve people's health, the more you increase the population, and therefore the demand. So it can be can become an academic argument. So it's not an easy thing to do. And even within the conservation organizations, we still have our own challenges of convincing some people that we should do PhD work. But the examples that we are presenting here, I think the case has been made that the only way to succeed in your conservation work is to integrate with social needs.
I know, having had Jane Goodall here at the center a couple times, she speaks very eloquently about these linkages. So Dario at least has the benefit of the top person getting it, so to speak, right away and right from the beginning. Jason.
Thanks, Jason Bremner from PRB. Thank you for your presentations, and I've seen a number of these sort of exposés where we have presentations to the community in Washington about these types of projects, and I think it's a great outlet for professionals in the United States. I'm concerned with how this message is getting out to your peers in your own countries, and whether or not Sam and Dario in Kenya, if other people in other organizations know about your work or this integrated approach, and in DRC. Have there been are there opportunities for you to share the experiences, or are there networks that are set up that allow you to share these experiences?
Thank you for the question. I will mention something that is really amazing in DRC. Before we arrived there, as I told you, these leaders, these community leaders, already decided to create some reserves, because they knew that they have to protect at least the environment, because they are seeing the consequences in different areas. In the village they live in, all the trees are cutted, the water is bad, so at least they are always obliged to go far away from where they live, and there are risks for that. So at least these people really want to to conserve their nature. And it has to come from them. At least the people who work for NGOs or any kind of organization, they can just help them to reinforce their desire to protect what they have. And that's exactly what we do. So at least when I went back from Ethiopia, I was with Gib, Joff, and Joff. I went back and I said that I will go there and elaborate an action plan, and that's exactly what we did there. We decided what are our priorities, from where we have to start, and how we will start to elaborate an integrated approach. So I think that it's already accepted by the people there, and if sometimes the donors or the people in the office don't see the clear link between environment, population and health, the people who live there in the villages see it. So
yeah, let me mention that in Kenya we are not, WWF is not the only organization who are doing this kind of work. I'm aware of the biodiversity conservation project of the European Union working with the pastoralists in the north of Kenya. And last month, September, I had occasion to visit 4 conservancies, try to look at what lessons the fishermen who I work with, what lessons can they learn from pastoralists who are doing the same thing. So we are not the only ones who are doing this. There are other projects that are doing this. In terms of getting other colleagues to get a dose of this PHE work, yes, we, like I mentioned earlier, we are planning an exchange visit for colleagues based out of the Nairobi office to visit the area just shown you here, to experience the work that we are doing. And this is with a view to arouse interest in them to start similar things, similar projects within their program sites, be it freshwater, savanna, or forests.
And I think, Jason, just to put it back in some ways on you, I think the regional network programs that PRB has been so instrumental in doing for East Africa, in the Philippines and such, those are some of the, at least from my vantage point, some of the most effective mechanisms where there's been that lessons learned sharing process that many of, I mean, this was the Ethiopia conference a number of us have referenced, that's been very useful. And so if you haven't connected to that process, PRB and Jason's a good one to talk to about that. We did get a question from a journalist online who wanted to ask, particularly from the Africa cases, whether you have seen any difference in public attitude and environmental awareness before and after the Greenbelt movement, and Wangari Maathai was recognized with the Nobel Peace Prize. In many ways, the Greenbelt movement has many of these different integrated programs and objectives in it. Is that something that has been detectable at all in terms of giving you more political space to operate in? Makes sense to start with Kenya.
The environmental movement in Kenya has been growing from strength to strength. Of course, we all recognize and appreciate the efforts of Wangari Maathai. A lot of community groups have come up to do work in afforestation. Right now, the key issue in Kenya today is conserving water towers, sort of these mountain forests that act as the catchment, water catchment areas. Right now there's a very hot political debate where some people are supposed to be moved out of a forest which is a water catchment area. So there's an increased level of awareness within Kenya on the need to protect the environment, and especially to protect water catchment areas that provide water to people, especially in the cities. So there is an increase, yes.
Okay.
I will say that since 2004, that's exactly when we started our program in DRC. As I mentioned, more than 2 million hectares of community reserves were created, and I think that if we have to talk about conservation indicators of the desire of the people to protect the environment, this is one of them. But I think that we have to know that people in Africa, and especially who are living in the Congo Basin forests, really want to protect what they have there, because everywhere the people who have access to knowledge know that this place is so important, and the situation of the Congo Basin actually is so critical, as you may have seen in the satellite image. Sorry, my French sometimes it's just an as you saw maybe in the satellite image, the Congo Basin is the only remaining intact forest in Africa, and one of the latest in world on Earth. So at least people know that they have to protect their environment. Now the question is, how do we address their problem? How do we respond to their needs? And that's exactly what we have to think about and do now.
Perfect. Thank you, Dario. Ray?
Can you tell us a little bit about Ray Schoenholtz here at the Woodrow Wilson Center, public policy scholar. Can you tell us a little bit about the types of conflicts you're encountering at the local level and the processes, if any, that you use or others use to respond to them? And secondly, you both, the last two speakers, Sam and Dario, you've mentioned you mentioned the water catchment areas and the political sensitivity about moving people out from a public policy process. What's being used to do that in a constructive way, or is it just a government edict? And to Sam, well, in the point you just made, what are the methods used then to deal with that kind of problem that you just addressed?
Go ahead.
Well, I don't think I would like to comment on behalf of the Kenyan government, but what's happening is that the people who have settled in this particular water tower basically have to be resettled elsewhere. That means identifying land for them to settle and to provide some kind of mechanism for them to reestablish their homes elsewhere. In terms of the conflicts that you mentioned, I can talk about Kiunga, not Kenya in general. There are issues, when you're thinking of an area with challenges, inadequate resources for survival, there's a big conflict between natural resources and human survival. You're trying to protect this, and I think from Dario's presentation and my presentation, you kind of realize that these biodiversity hotspots are usually in the very remote areas where there are very few, if any, public amenities. And that can be a challenge for you if, for example, you're seen or you're perceived by the local people to be in a position to address one of their needs. You become a source of inspiration for them, and therefore you become the recipient of all their requests for assistance. Can tend to replace what government is supposed to provide. And if you cannot provide that, it becomes a headache for you. It becomes an issue. You're not supportive enough, and can be counterproductive to your work. And that's why it is important to work with the community groups and community leaders, and that they understand that you are only able to do so much, and that you have a primary focus, which is environmental conservation, but integrating a few of these human needs. One of the biggest conflicts we have in Lamu Kiunga area is with the fishermen, because they ask you a key question. Why should we protect marine turtles here in Kenya only for them to be eaten in Somalia? Are we protecting for the Somalis to eat? Now, how do you answer that? You have to try and explain that whatever little action that you take here locally is a global effort, and that to even protect one marine turtle requires the effort of everyone, not just the villager there or anyone in Washington who's making policy. That it's a global effort. For them to understand that, it may be a challenge, but nevertheless you have to face it.
I will say that the movement of population is most of the time in our country, in DRC, the consequences of the conflict you are talking about. But I will make the point on this insecurity in the eastern of the country, eastern DRC, where we work. The first component I want you to take into consideration is that we work with community leaders, which are called the kings, in local language, the mwamis. These people have a real influence on any kind of armed group in the area. So when these people are against these groups, they cannot live in the places the community leaders are. Another thing that I will mention is the size of the area we are talking about. Eastern DRC is a really big area, and when we talk about the problem, the conflict and the insecurity, we talk about two little places which are called Masisi and Rutshuru, and on the size of the landscape it is less than 10%. So we don't work where people are fighting. We work where people want to protect their environment and want to have a sustainable development. So at least it's true that sometimes some army group can move from one place to another, but there is an aspect I want to bring up here, and is the fact that people, they don't want to go and destroy some projects which are funded by USAID or any kind of international NGOs, because they just know what can be the consequences to attack or destroy something that people took times and a lot of funding to implement. And these leaders, these community leaders, are helping us in the same direction. And I will also say that even if sometimes there are conflicts, the work we are doing help the people who live in this zone of conflict, because at least the question I was asking to these people who are in army group is, why are you taking some weapon and go fight for something that you may not trust in it? And they were just telling me, because now I can eat every day and I have a weapon, so I am powerful. And the main problem there is because the level of life of people is, they live in extreme poverty, so at least it's easy for these people to have a weapon and be stronger. I will continue by saying that we heard a lot about rapes women in DRC, and that's something so bad which is happening in really precise area where all these controlled people are, and it's so bad that we have to talk about. So what we do, and we saw a lot of raped women who came in the different villages where we work, because now they have access to primary health care. It's something, when these women are in bad health condition, they don't have access in the conflict places. So we are seeing movement of these people coming and trying to find peace where we are working. And I will finish by saying that what we are responding to is a question that interests all of us. When we are talking about climate change, when we try to protect the forests, when we try to have a sustainable way to live with the nature, when we talk about global security, because this is a real problem there. A lot of people living in poverty can be easily influenced to incorporate some group army, and this is at a local level, but it can be more dangerous if we don't do anything against that. I will say also, we are talking about preserving the species, not only the animal species, but all the trees, the vegetation species. So at least we are talking about big issue there. And I will say, by taking that into consideration, even if the situation is not always good there, we have to work there, because we can't not do nothing there. We cannot say we will move from there, because there is sometimes insecurity. But we are trying to work carefully, but at least effectively.
Question over here, Rachel, if you could bring the microphone down front.
Hi, I'm Mark Peterson from the Board on Global Health at the Institute of Medicine. And I was wondering what role you thought there might be for private companies to partner with NGOs or government organizations in PHE work. And do they have anything to bring to the table? And if so, what might encourage them to get more involved?
And you want to start, since you're partnering with one of those companies? Yeah.
Yeah, I think for private companies, it's very essential that you partner with people like us, because we are integrated in terms of our conservation efforts. While it takes 30 years to see a young hatchling coming back to lay the eggs, we can build a dispensary and show it to you in your lifetime as a CEO of a private company. And I think that's what you want to see. It's difficult for most private companies to see a tree growing in 30 years. It's difficult for most private companies want to see impact now. While conservation projects are about the future, it's a future desired condition. But when you integrate PHE work into your environmental work, you're able, like what I showed here is that there was no dispensary, now you have one. There was no borehole, we can show you the borehole. And that's really an opportunity for private companies to engage, because they can see the results firsthand.
CI does do a lot of outreach to private companies. We have a whole division that works on that, and I would have to say private medical companies is something that we haven't really investigated, but we are looking into. We're thinking about that. So also I should mention on behalf of World Wildlife, their Global Development Alliance, which they just did with Johnson & Johnson, which is a major achievement, with Johnson & Johnson putting in $1 million and USAID putting in $1 million. So that's a huge achievement that they've made. So.
I will not add more. I think some summarize what I think we can obtain quick results in what we are doing in different activities. So, yeah.
Yes, right back over there.
I'm Lutfia Ahmed from Winrock International, and you've talked about deforestation. That's a big threat to conservation, and your health programs are also addressing child health issues like ARI. And I'm wondering if there's a need or opportunity for household level energy interventions, specifically fuel-efficient, clean-burning cook stoves, which would address the deforestation aspect as well as the child health aspect.
Yeah, we do actually do a bit of that. I just kind of gave you a snapshot, but we are doing some things like that. And also I know other organizations like World Wildlife in Nepal are working on biogas stoves and that kind of thing. So there are efforts like that, but there's definitely a lot of opportunity there that we need to be working more on. Definitely.
Yeah, we're also exploring wind and solar power for 2 villages within our working area, basically to run these health facilities, provide some level of domestic power to some critical areas, like a small cold storage for fish to avoid a lot of very high post-harvest loss of fish. So we are working on it together with private companies that have donated this equipment.
Yeah, thank you for your question. I think you are definitely right. This is exactly what we need. When you ask people to protect their environment, at least, as I said, they don't want to destroy their forest. This is just because there is a real need. So, in fact, they are requesting already for green stoves, these fuel-efficient stoves. We are also working on a project of briquettes, which are little bricks made with vegetation and carton. Is there anybody? Sorry? Yes, old boxes and paper that people collect in different villages. So at least this is a response. So what we try to do with what we did with the community was to say the reserves, you cannot go and touch it anyway. The place where they are living, we call it the development zone. That's somewhere where they can have activities or any kind of business there. And between the protected reserves and the development zone, there are what they call the buffer zone. This is somewhere where people can plant trees, or sometimes they can go for hunting or cutting some trees, but they need to have the agreement of the local management committee of the reserves. So at least this is a way to respond to their needs. Yes.
Terrific. Well, I neglected ahead of time to say that we have the good fortune of being able to have a reception after today's meeting. So I'm glad so many of you have stayed so that we can continue this conversation informally. I think the three of you have given us an awful lot of insight into what you're doing, programs that are not at the beginning, obviously, but not at the end. And so that's terrific that we'll be able to hear about more of what you're doing. So we thank you very much for doing that. And also urge everyone to kind of take advantage of these cases and telling people and pointing them to the websites, and certainly ours will have reports from this meeting and the video and such, but also some of the different publications by a range of the people here trying to capture some of these cases and share these lessons learned across regions, because of course that's a big part of why we group these, so that we can share the lessons learned from these field-based programs and try to improve all of our joint endeavors. So please join me in thanking our panelists for really an outstanding session.